Welcome, everyone. We're going to go ahead and get started with today's webinar. I'd like to welcome you all to the Health and Education Policy Landscape. We're excited you could join us today and hope that you enjoy our webinar. My name is Alex Mays, and I'm the National Program Director of Healthy Schools Campaign, which is the organization that's hosting today's webinar. I'll be moderating our webinar and just wanted to start us off by quickly reviewing some logistics for our session today. Our webinar is scheduled for an hour, and we'll be sending out the presenter slides following the webinar. So look out for an email from Healthy Schools Campaign later, or I guess it'll be early next week, and then they'll also be posted to our website. We also have a very quick survey at the end of the webinar, and we would really appreciate it if you could take a moment to complete that webinar to share that survey to share your feedback on the webinar with us. We will also be saving time at the end of the webinar today for question and answer. So I know we're going to be throwing a lot of information at you through the presentations. Please feel free to send in your questions throughout the webinar by typing your question into the questions box, which is on your control panel. And then we'll be collecting those throughout the webinar, and we'll move through them and after our formal presentations are done. Next slide, please. So the objectives for today's webinar, we really want to, as the name of the webinar implies, provide you with an overview of what's happening in terms of the policy landscape at the national and state levels at the intersection of education and health, and really highlight some of the trends that we're seeing at the national level and state level in terms of policies that impact health and education, and really want to focus on lifting up key ways in which you all can become involved in efforts that might be happening in your state. Next slide, please. We have a great lineup of speakers joining us today. We're thrilled to have Sandra Wilson from the National Governors Association, Hon Akash from Center on Budget and Policy Priorities, and Ann Bowles from the Council of Chief State School Officers. Next slide, please. So before I hand it over to our first presenter, I just wanted to offer some framing for today's webinar and share why at Healthy Schools Campaign we wanted to host this session today. So at the core of Healthy Schools Campaign's work is the belief that every student and staff member deserves the opportunity to learn and work in a healthy school environment, and that health is really critical to learning. And so we believe that supporting healthy school environments is a key strategy for ensuring students, and particularly low-income students of color, thrive. And believe that school health programs and policies can play a key role in helping both the health and education sectors meet their goals. And so the reason we wanted to host today's webinar is that there's been a lot happening at the federal and state levels with regards to health and education policy, and we know folks have been hearing about various changes in policies and been eager to understand how those changes potentially impact their work. We really do see, many of those policies as creating opportunities to support the health and education of children, and particularly vulnerable children across the country. And so between the midterm elections last fall and the resulting changes in state leadership, the president's fiscal year 2020 budget, and just increased attention around key issues such as the opioid epidemic and school safety and Medicaid, we have been seeing a lot happening in this space. And so some of these changes we certainly see as creating opportunities. We recognize also some are creating barriers and challenges, but feel like it's really critical to understand the broader context of the health and education policy landscape, to understand where there might be opportunities for supporting the health and education of kids, and potentially where defense might be needed around existing policies and programs. So we wanted to take the time today to bring in a few experts to share what they're seeing in terms of the trends and opportunities and where the priorities of their organizations and members are laying. We also are always looking for legislative and administrative ways to advance good policy that really supports that critical connection between health and learning. And we recognize that this is a particularly chaotic time in terms of advancing health and education policy, but really want to lift up that there is good work happening and that there can be tremendous value in identifying where there might be small fixes or opportunities to take small steps forward in implementing good policy. We're going to hear from both Sandra and Ann, who work at the state level, and I think it's really critical to understand where those opportunities might be at the state level, so you can understand where there could be unique opportunities to move your state forward with this work. So without further ado, next slide, please. I want to introduce our first speaker, Sandra Wilson from the National Governors Association. At NGA, Sandra focuses on issues related to behavioral health and social determinants of health and the innovative integration of these into health system transformation efforts. She leads the NGA Center's technical assistance work with states, advancing programs for high-need, high-cost populations. We're thrilled to have her joining us today, and so I will now hand it over to Sandra to kick us off with our first presentation.
Alex, thank you so much for this, and I'm really excited to be able to participate on today's webinar to share with you some of what we're hearing from governors and their senior state advisors around the nexus of health and education. And as Alex noted, I'm coming from the health side of the equation, and even more specifically from behavioral health, but have been leading some of our cross-division work, which we're hoping reflects what's happening on the state side, around a few different projects that I think might be worth telling you a little bit about today. But before we start, if we could go to the next slide, I just wanted to remind people, and then the next one, please. I just wanted to remind people, first I should tell you a little bit about NGA and who we are and where my comments are coming from. So the National Governors Association is the oldest organization serving the nation's governors, all of the nation's governors from the 55 states and territories and commonwealths. And to that end, we are a bipartisan or nonpartisan organization, and we have essentially two sides. One is the advocacy side, which does the lobbying on behalf of governors, and I sit on the other side of NGA, which is called NGA Solutions, where we serve as a think tank consultancy operation that supports governors, key policy advisors. And I think it's important to note that everything we do is in response to what governors are driving and what their key senior officials need to learn about and beg, borrow, and steal from other states. So we do a lot of connecting states with each other and prioritizing work that governors are running after right now. And so to that end, my comments are really going to be about lessons I've learned from working with states and sort of observations from that side rather than any official statement from the National Governors Association. But with that disclaimer aside, I'll say it's actually on the state level a super exciting time, I think, at the nexus of health and education for a few different reasons. We are building several projects at NGA that are at that nexus, which I'll describe in a minute, that I think reflect where governors' priorities are. Next slide, please. Okay, this is just a reminder for everyone. This is probably old news to you about what happened during the midterm elections, and I highlighted here because there's been a ton of turnover on the gubernatorial level. Next slide, please. And also on the legislative level. So this is just by party breakdown to show that it's not just turnover from one party to another, but within parties, in that it's been a pretty dynamic shift all the way across the country, not in one specific region of the country. Next slide, please. And then the next slide shows you a little bit more about what's happening on the legislative front. A lot of, this gives you just the overarching landscape across the country. And the next slide, please, shows you where some of the changes occurred. This is where new legislative leadership is sitting, which is all over the country as well. So I highlight this just to orient folks to the fact that we've got a ton of new leaders in important positions that are just getting their legs underneath them, just trying to figure out right where the bathroom is and the pencil sharpener and all that good stuff. And so it's still relatively early days for some very substantial policy change, but that time is coming now. It's coming now on the heels of most states are coming to the end of their legislative session with some exceptions, but most states, by the end of June will be at the end of that. So new leadership has really been focused on legislative issues, budgetary issues, and once that is finished can take a deep breath and a step back and really dig in more into some of the policy domains and connecting more with stakeholders on some of the policy priorities under the governor's agenda. So just wanted to flag that for folks. Next slide, please. Okay, a couple of things before we get into what the priorities are, what some of our projects are that may stimulate some thinking for you about where you want to engage with your leaders in the state and your governors. A couple ways to do that. One, I already mentioned, connecting with the right state leaders is a matter of timing. Of course, there are always political considerations. You all know this well in your day-to-day job and also as individual citizens in your state. But really thinking about what is the political climate around the specific issue that you're most concerned about, and what are the political leanings of the leadership in the state before you go in and have a conversation with them is really critical. That's just a reminder for what you already know, I'm sure. Connecting with state leaders, even outside of the governors and legislative directors, policy advisors, agency heads, really understanding what is their role, what is the right timing for connecting with them is key. And as I mentioned, probably starting now and maybe towards the end of the school year, for those of you who are educators and super busy with all that anyway, is a good time to really get their attention. Of course, you want to tailor your approach and have an ask. It's really important when you go in, not just to educate or express concerns, but to have a very clear understanding of what you want them to do and maybe provide some strategies or solutions for them to consider. And finally, I think right now, as I mentioned, when legislative session comes to an end, many governors and leaders are going to be reaching out to key stakeholders to really understand, how the agenda for the governor can be realized and really what needs to be tweaked, with an understanding from those of you who have deep expertise outside of state government. So those are just some considerations for you as you move forward. Next slide, please. Okay, this is where I want to spend the rest of my time, it's a lot of information, and I left it here as a takeaway for you all. So I'm not going to read through every word here, but it's really a takeaway around priorities for us at NGA Solutions, which again are directly shaped by governor's priorities. And I listed them here in no certain order, with the exception that jobs and economy is always number one in states. Number two, often in states these days, is opioids, which is actually down lower on the list. But those are two really big topics that are driving a lot of the state priorities and conversations, and jobs and economy is always at the top of the list. So something to keep in mind there. Of course, with respect to education, there's also really important considerations with respect to how do we develop the pipeline in our state for a very productive citizenry, and that's where, education and your expertise can come into the conversation. Listed here below under education are some of the bullets that I got from our education leads at NGA Solutions, and this is what they're observing. They've been monitoring really closely campaign speeches, state of the state addresses, and looking at state budgets to understand where some of the governor's priorities are. And I think it's super encouraging that they've noted for me that 22 of the 36 newer reelected governors are discussing whole child issues, both during their campaign and after. And when we talk about whole child issues, highlighting things like social emotional learning in schools, mental health and social service wraparound supports for students and families, parent, family, and community engagement, community and school approaches, and bolstering school counseling opportunities. So really a wide array of wraparound supports are being discussed as they think about whole child issues. So that, I'll remind you, 22 of 36 of the new re-elected governors have put this as one of the front and center items for them. Along these lines, one thing that's of interest is Governor Walz from Minnesota has talked a lot about whole child issues. A former educator is actually going to help us host a convening. I'm jumping down a little bit to the school safety piece, helping us host a convening in Minneapolis. It's going to be in July, where we invite governors, policy advisors, secretaries of health, superintendents of schools, et cetera, to come to the meeting, and we're going to talk about school safety. What is really exciting here, and why it tags onto the whole child focus, is that we have moved a lot of the conversation in states from just school safety issues like school hardening and resource officers, which is really important work, to really thinking about how can we have a cross-sector approach to student health, well-being, and safety and success. So we're bringing together Homeland Security public safety advisors, health and behavioral health advisors, and education advisors in governor's offices to come up with cross-sector, cross-cutting plans to support safe and thriving schools. And to me, that's super exciting because we've moved very far down the road of really having a cross-sector approach that recognizes best practices in both education, health, and behavioral health. So you can see other things there. Again, I won't read them. These are some of the areas of focus: workforce education, childhood education, really lifting up teachers and supporting teacher compensation, and the like. On the healthcare side, and where this dovetails, in addition to the school safety piece, there is a ton of interest on health system transformation. You all know this. You hear about it all the time. One of the areas of focus is more complex populations or complex issues, and one thing that has come to the fore for governors and has for the last couple of years is how do we address issues of behavioral health. So opioids crisis is key, but also other issues of behavioral health across the lifespan, and there's a real recognition that we have not done a good service to people with behavioral health needs. We need to transform our system. We need to invest in it, and we also need to incentivize best practices. And that includes in and around school settings for students, for administrators, teachers, and for families and communities as well. So that's one area that I work in very closely and work closely with our education folks in. And you can see the others here as well. One other thing I wanted to highlight for you is there's a lot of interest on the governor's part around adverse childhood experiences and trauma-informed work across multiple settings. We'll be doing more projects there. And I'm currently running a project, and we'll be doing more around children's cabinets, which is really an effort to help state leaders understand what governance structure they need to put in place to coordinate all child and family serving work in a way that's most effective and efficient. And there's a lot of interest on the part of states there. In fact, there are a number of states where there are new administrations that are either establishing or revitalizing children's cabinets. So I'm gonna stop there. There's a lot more I can say about each of these projects, but hopefully it gets you a flavor of if this is what we're working on, this is what governors care about, and that there's a lot of energy at the nexus of health and education. And I'm happy to take questions or talk to people offline after the other presenters present.
Wonderful. Thank you so much for kicking us off, Sandra. That was a fantastic overview, and I really appreciate you going into that level of depth about where you're seeing the priorities of governors. I do want to acknowledge, I know a few people have commented that there's some static noise. I apologize for that. We are looking into it and working to resolve it. So just wanted to acknowledge and apologize for any feedback folks might be having. So next slide, please. I'm going to transition to our next presenter. Actually, one more slide. So next we have Hon Akash, who is a senior policy analyst at the Center on Budget and Policy Priorities. Prior to joining the center, she served as an administrator for the California Medicaid program, where she oversaw the state's Medicaid managed care program, long-term care program, and a program for children with complex medical needs. She played a key role in developing and implementing cross-cutting policies and programs for the state, including a renewal of California Section 1115 Medicaid waiver and the development of a health homes program for patients with complex needs. We're thrilled to have Hannah here with us today to share more about what we're seeing in the national policy environment on the health side. So Hannah, I will hand it over to you now.
Wonderful. Thank you so much for having me. I am just going to talk briefly about the health policy priorities and challenges that I'm seeing at both the federal and the state level. And then I'm just going to touch on a few things briefly, and I'm happy to answer any questions at the end. So next slide, please. So similar to the conversation for folks who were there at the conversation we had earlier this year, Congress is largely focusing on laying the groundwork for 2021 and developing a real policy platform. Although members in both chambers and on both sides of the aisle are working on legislation, it's unlikely that a lot of that legislation will pass this year. And I'll talk more about that in a minute. There's still some really important work going on. And then in the meantime, state legislators are really active on healthcare issues in both Medicaid and the private market. So I'll dig into that a little bit as well. Next slide, please. So at the federal level, health policy priorities, I think, fall into four primary buckets. The first is prescription drugs. As I'm sure everyone has seen, both the House and Senate have had multiple hearings and are reviewing lots of legislation that focus on prescription drug pricing and affordability. The second bucket is health coverage affordability more broadly. Members in both chambers have introduced broad legislation to improve the affordability of health coverage and close loopholes that can increase prices for consumers, such as surprise billing. The third bucket is oversight. The House, in particular, has been focusing on oversight of the administration and its implementation of various healthcare laws, including looking at likely sabotage of the Affordable Care Act and lots of other implementation. And then the fourth bucket is sort of a catch-all, but it's mostly sort of extending or supplementing existing health programs. So, for example, Congress must pass legislation to reauthorize various health programs this year, such as funding for federally qualified community health centers and relief for Puerto Rico. This bucket is the most likely to be enacted. Next slide, please. So as I mentioned, the bulk of the activity on health policy is really happening at the state level this year, particularly on Medicaid. And this slide just gives sort of an overview of the Medicaid demonstration waivers that are currently approved or pending. Of course, not all of these waivers were approved this year, but it gives you sort of a sense of how much activity is happening at the state level. And these include both delivery system reform waivers that are changing the way that states deliver or pay for care, and then also particularly a new trend in restrictive waivers that limit eligibility or access to care. I'm going to spend a few minutes talking about those because those are sort of the new trend, and then I'll just spend a minute talking about some of the delivery system reform waivers as well. Next slide. So as we talked about earlier this year, much of the new waiver activity is unfortunately focused on Medicaid policies that take coverage away from people who don't either meet work requirements or pay premiums or submit renewal paperwork on time. And what we've seen from the research is that these waivers are really harmful. The vast majority of adults with Medicaid coverage are working or they're unable to work, as this chart shows. This leaves a very small share of people who are actually being targeted by these waivers. If you think about 60% of non-elderly adults with Medicaid coverage are already working, and of those who aren't working, the vast majority are ill or disabled, have caregiving responsibilities, or are in school, as you can see here. That only leaves about 4% who aren't working or in one of those categories. Next slide, please. But even though only a very small sliver of people are actually being targeted, we're seeing that these waivers affect many, many more people than are in the target population. So Arkansas is the only state to begin taking coverage away from people who don't meet a work requirement. And what we've seen is that far more than 4% of people are losing coverage. It was about 8 and 29% of those subject to the requirement have lost coverage each month in 2018. And that's likely because of the burden of reporting or navigating these complicated requirements. Over 75% of those who are required to report hours, many people are exempted from even the reporting requirement, but over 75% of those required to report have failed to do so in each month, and that's leading to these really large coverage losses. A district court judge recently halted the implementation of both Arkansas and Kentucky's work requirement policies, but HHS is appealing that decision, and meanwhile, other states are continuing to implement them. And in 2018, we saw more than 18,000 Medicaid beneficiaries in Arkansas lose coverage due to the work requirement, or about 1 in 4 people out of the total number who were subject to it. One particularly sort of important story, I thought, was reported by PBS, and it was the story of Adrian McGonigal, who was a gentleman in Arkansas who has Medicaid coverage. He was actually working full-time in a chicken processing plant. He heard about the work requirement, and he went online and reported that he was working full-time, but unfortunately, he didn't realize that he had to report every single month. He thought he only had to report once. So he ended up losing his Medicaid coverage after a few months of failing to report. And even though he was working, he was locked out of coverage. And so Adrian, unfortunately, has multiple chronic health conditions. He has COPD. And when he went to the pharmacy, he discovered that he had been locked out of health coverage. He couldn't afford to pay out of pocket for his medications, so he got really sick. And when he couldn't go to work, he lost his job. So this is just one story, but I think it's a good illustration of how harmful these coverage restrictions can be, even for people who actually are working. I also just want to spend a minute talking about some of the delivery system reform waivers and other sort of payment reform, either waivers or programs that states are pursuing, because in addition to the trend in restrictive waivers that are causing a lot of harm, I think states are doing some really interesting and important work changing the way that their health system is designed as well. I'm sure folks saw that MMI released a couple of new opportunities earlier this week. Those are currently primarily in the Medicare side, but some managed care organizations, particularly those that are covering dually eligible beneficiaries, may be eligible to participate. And I think there's a lot of interest in seeing if those demonstrations can, that if state Medicaid agencies can align their programs with those new CMMI models. A couple other really interesting models that I will mention. Of course, Oregon has longstanding coordinated care organizations, which are state-level accountable care organizations that are partnerships between providers, health plans, and community organizations. And those ACOs provide the full range of medical and behavioral health services. And there's now a lot of evidence showing that those partnerships, those ACOs, have been really effective in increasing primary and preventive care, reducing unnecessary emergency department use, and providing some flexible services that can address social determinants of health. Wisconsin has a really interesting model centered around one of their children's hospitals that wraps around their really high need kids and tries and essentially creates linkages between those kids' hospital-based specialists and their community-based pediatricians to facilitate better community-based care for really high-need kids in Medicaid. That has also been showing some really fantastic results. And there are other programs outside of sort of the 1115s or CMMI models, like Missouri's has a couple of really effective health home programs. There's one for physical chronic conditions and one for people with behavioral health conditions. Those have also shown to reduce emergency department visits and preventable hospitalizations. Tennessee has a really strong money follows the person demonstration. So there are lots of other examples of places where states have been investing in their community-based organizations and in their delivery systems. And I will leave it there for now since I know we have limited time, but I'm happy to talk about any of those things at the end if there are questions.
Wonderful. Thank you so much for that information and for highlighting so many fantastic examples, Hannah. We really appreciate it. Next slide, please. So next, I'm going to introduce Ann Bowles, who is the Program Director for Student-Centered Learning at the Council of Chief State School Officers. Ann is responsible for providing overall direction, coordination, and supervision for the Innovation Lab Network and the Council's strategy on student-centered learning, including social and emotional learning. Prior to joining CCSSO, Ann served in a number of roles in the policy, advocacy, and leadership teams at Achieve, a nonprofit committed to working with states to prepare students for success in college and career. Ann began her career in education as a middle school teacher in New York City through Teach for America. So we're thrilled to have Ann here to share what's happening on the education side and what the Council for Chief State School Officers has been working on. So Ann, I will now hand it over to you.
Wonderful. Thanks so much, Alex. And thanks for having me. I'm really happy to be here to share a little bit about our work at CCSSO and opportunities for collaboration to improve outcomes for students. And I'm also working at CCSSO to help coordinate our board president, Pennsylvania Secretary of Education Pedro Rivera's board presidential platform, which is focused on improving conditions for learning, which really aligns with a lot of the work that the Healthy Schools campaign advocates for, which I'll get into more detail on in the presentation. But first, next slide, please. I'd like to share a little bit of background in CCSSO and our work. The Council of Chief State School Officers is similar to NGA, a nonpartisan nationwide nonprofit organization of public officials who head departments of elementary and secondary education. We bring together state policy leaders, education experts, and others to create and share solutions to common issues and really strengthen the knowledge, skills, and capacity of chief state school officers and their staff. We also do advocate for supportive federal policies at the federal level. Next slide, please. Equity is core to everything we do at the Council. We really believe that we must build a more equitable education system to prosper as a society and a country, and that each student receives access to the educational resources and the rigor needed for college and career readiness, and to participate in a pluralistic society. To us, as an organization, equity really means ensuring that each student has access to the resources they need at the right moment in their education, including access to high-quality early childhood education, rigorous coursework, opportunities to take college and career-ready courses as well. And in February 2017, CCSSO and the Aspen and Education Society program published a Leading for Equity document referenced here, Opportunities for State Education Chiefs. And in that document, we outlined our definition of equity at the Council, as well as 10 commitments for state chiefs on how they can advance equity for every student. And next slide, please. Our strategic plan, I won't get into this in too much detail, but just to note that the strategic plan is grounded in a commitment to each and every student, regardless of background, graduating ready for college, careers, and life. And then we're working proactively to integrate those equity commitments that I mentioned into the strategic plan. And that leads us, next slide, please, to our current board president's presidential platform, which is centered on one of those 10 equity commitments, equity commitment number 9, improving conditions for learning. As president of the council, Secretary Pedro Rivera is president from November 2018 through November 2019, and he's focusing his platform on improving conditions for learning so that all students have the supports they need to be successful inside the classroom. Specifically, and I'll emphasize this a couple of times, Secretary Rivera is supporting state leaders in achieving educational equity through an increased focus on partnerships, particularly partnerships with community organizations and other community advocates to set conditions for learning so all students have the supports they need to thrive. And he is focusing specifically on meeting the needs of students around food security, physical health and wellness, mental health, and homelessness, which I know can also be really grouped together as health and wellness for students. The Secretary is committed to raising awareness around improving conditions for learning through the power of the bully pulpit. Given his role as president, he's also committed to elevating strong examples of what state education agencies are doing in these areas, as well as encouraging us at the council to develop tools and resources for SEAs to advance work in these areas, and to partner with other organizations like the Healthy Schools campaign, NGA, for example, as well, to support our members in improving conditions for learning in those 4 areas. Next slide, please. The two resources, the first two resources that we've developed aligned to his platform are listed here. They're also, you can access them on that URL that was on that previous slide. Pedro has shared these with every state chief and their staff, and he's also spoken about his platform at 2 of our 3 annual member meetings. And we really hope that this increased awareness presents an opportunity for advocates, teachers, principals, and parents who are interested in school health to feel empowered to engage and reach out to their districts and their local education agencies and their state education agencies to see how they could partner to help them reach these shared goals. And as I mentioned before, throughout this work, Secretary Rivera and CCSSO are elevating the importance of partnerships and the critical role that other agencies, community organizations, advocates, families, and their communities play in improving conditions for learning. We certainly believe that SEAs have a role in elevating this importance, establishing those really good working relationships, and supporting local efforts. And we don't want this to be one more thing that teachers need to do also on their own, and really want to elevate the critical role that partnerships take and that continued focus on stakeholder engagement and equity. And you'll see the first 2 resources there. The one, Setting the Right Conditions for Learning, includes a number of examples of what SEAs are doing in those 4 areas. And then the other one is a more technical funding guide, really listing the different funding streams that SEAs can pull from to fund work in those areas. So we're also encouraging state chiefs to take a number of actions to improve conditions for learning, and a couple that could be relevant for this audience is we're encouraging them to work with their local education agencies to improve conditions for learning, including by addressing chronic absenteeism. We recently hosted a meeting in partnership with Attendance Works, and the Healthy Schools campaign was also there for the 36 states plus DC who are including chronic absence data as an indicator in their accountability systems. And we see tremendous potential in that data for SEAs and districts to more proactively improve conditions for learning, particularly in the areas of health and wellness, food security, and homelessness. And then other actions we've encouraged state chiefs to consider include revising exclusionary discipline policies and exploring alternative strategies, advocating for the provision of state resources to support mental and physical health resources for schools with the greatest need, providing incentives or competitive grants or guidance for the creation of community schools, and other mechanisms for providing school-based comprehensive services to low-income communities, and then measuring and improving school culture as an important aspect of closing achievement gaps. And again, throughout, we're encouraging SEAs to develop stronger relationships with their states, LEAs, and with nonprofit organizations and coalitions in their states, and would encourage you to position yourself as a resource. And then next slide, this will be, we'll wrap up with this slide. And then definitely happy to take questions as well. We have 2 additional resources. So as Sandra mentioned at the top of the call, similar to governors, we've seen over this last year a real emphasis on social and emotional learning and academic development, conditions for learning, and whole child supports. So we're seeing practitioners, researchers, and policymakers increasingly focusing in on these areas. And we know from the science of learning and development that in order for children to master academic content and develop skills necessary for success in school, they need learning environments that foster relationships, and we know that they need to have those foundations met around food, health, and wellness, and housing. And we're really seeing that reflected in work at the state level. So we're seeing states beginning to include language measures and supports around these areas in their state ESSA plans, the abbreviation for the Every Student Succeed Act, which really guides a lot of work at the state education department. So one of those tools there that we developed in partnership with Education Council really details some of the levers at states' disposal within ESSA to address those areas, and then also highlight some examples of what states are doing. And this is really an important shift because it signals a move away from focusing mainly on academic performance for purposes of accountability and supports for schools and districts, and the need to support the whole child to help each and every student thrive. And would definitely encourage you on the call to, if you haven't already, check out your state's ESSA plan and look for opportunities that you could play in helping the state reach some of the goals outlined in those plans. And I think I'll just note we also have a webinar series coming up that's open to the public, and I can share that link with Alex, and she can share it with the participants on the call on these two resources that are coming up next week. And then I'll just end really with underscoring that here at CCSSO, we really share the belief that health and wellness, including mental health, play a critical role in ensuring students are set up for success, and that partnerships between agencies, with community organizations and advocates are essential to ensuring that success, and really encourage and are grateful for the work you're doing and encourage you to continue to take advantage of this opportunity to partner with local districts and your state agency in your efforts to improve outcomes for kids. And I'll end there, Alex.
Wonderful. Thank you so much, Anne, for that overview
Yeah.
and for going into the specifics of where CCSSO's priorities are and what you're seeing at the state level. Great. Next slide, please. And next slide again. So we'll now go into our question and answer session. So we've had quite a few questions come in, but really encourage folks to keep sending those questions in, and we'll work through them over the next 15 minutes or so. So my first question is for all the speakers, and just wondering if you could each share your thoughts on what you see as the biggest opportunity right now to improve policies to support health and education. Specifically, do you see those opportunities within Congress or at the state level? Would love to hear your thoughts on where you see those biggest opportunities.
This is Anne. Alex, I'm happy to start, and I would definitely say we see the biggest opportunities at the state level right now, and also a lot of opportunity at the community level. And I would just emphasize again the opportunities in partnership. I think there's a real recognition right now in the importance of working outside of our silos that we sometimes traditionally get stuck in, and thinking about the success of the whole child. So there's a greater, I think, interest and awareness of the importance of cross-sector partnerships, and I think there's a real commitment at the SEA level, I can say, to reach out and engage broader stakeholders, and would encourage folks to reach out and partner with local districts, as well as learn about opportunities or coalitions within their states that are probably a lot of these people are already aware of or already looking to lead on.
This is Sandra. I'll just chime in because we're at the state level, and of course that's where my bias is. I think there's a lot of opportunity at the state level. And I couldn't have said it better. I'll just add a few more details from my perspective, and that is there is opportunity and a gap between state and local level alignment around policy direction, maybe even alignment around allocation of resources. And so there's a real opportunity for you all to reach up to talk about that, and for state leaders to reach down, and I think there's an appetite for state leaders to do that. And the only other thought I would leave you with is when you do that outreach and we have those conversations, set goals or make requests, or really make sure that the conversation is such that it requires cross-sector work to meet that goal, right? So as you all talk a lot about thriving and successful children, I would say keep using that language because it requires cross-sector work, and there's appetite to do it, but there's still a lot of work to be done.
This is Hannah. I would agree with all of that. At the state level, in the Medicaid landscape, I would say, the continuing biggest opportunity is for any state that has not expanded Medicaid to do so. We've seen really important benefits in Medicaid expansion states for kids and adults, particularly parents, and many of whom were eligible, most of whom were eligible previously, but we've seen really significant effects even for the previously eligible populations. Beyond that, I think, as I mentioned, there's a lot of delivery system reform work happening at the state level in Medicaid. There's really important work happening to try to use Medicaid's flexibility to connect across sectors to better serve individuals and families. So ensuring that Medicaid providers and services are linked with schools, with housing providers, with nutrition providers, with, really making sure that all these the services that are being provided in the community level are linked and coordinated. So I think that is one of the most exciting opportunities that I see right now.
Wonderful. Thank you all for sharing your thoughts on that question. Next, we have a very specific question, but I think it is very relevant to this conversation about from somebody wanting an update on how states are implementing changes in the free care policy, which relates to school-based Medicaid claiming, and I am happy to take this one on. So very quickly, for folks who might be new to this issue, the free care policy was a long-standing Medicaid policy in place that said that school districts could only bill Medicaid if for health services included in a student's individualized education program, so special education services, which really it presented a huge barrier for school districts from getting Medicaid reimbursement for the majority of services that they might be providing. And so it had been seen as a longstanding barrier, and Centers for Medicare and Medicaid Services actually reversed that policy and removed the barrier at the end of 2014. But in the time that had been in place, many states had written that policy into their state Medicaid plan or other state policies, and states need to make the majority of states need to make changes to implement it. It presents a tremendous opportunity for expanding school-based Medicaid programs, and we know that delivering health services in schools is just a really important and effective strategy for both supporting the health of kids, but also supporting their academic achievement. And so just in direct response to the question of kind of an update on where states are in terms of implementing it, we've actually seen a recent uptick in activity and really feel like there's momentum building around this initiative. We can share as follow-up, actually Healthy Schools Campaign, Trust for America's Health, and Community Catalyst recently did a brief on all the state activity that's been happening. But the short overview is that there have been 3 states that have changed their state Medicaid plan, Louisiana, Massachusetts, and North Carolina to make this change. A handful of states did not need to change their state Medicaid plan, specifically South Carolina and Missouri are moving forward with implementing the change and did not need to make a change to their state Medicaid plan. And then there's about 10 or so other states that are very actively moving this work forward. So we'll certainly share that brief as follow-up. The Centers for Medicare and Medicaid Services has been supportive of states making this change, and I think really acknowledging the role that expanding school-based Medicaid programs can play in meeting the health needs of kids and just recognizing the value of meeting kids where they are. And, for those hard-to-reach populations, or especially when we think about how to address student mental health needs, supporting access to these services in schools can be a key strategy. So we've been excited to see momentum pick up around that. Great. So the next question is wanting to know if there are topics that any of the presenters feel are most salient to both health and education agencies, so where there might be overlap that could create opportunities for both health and education state leaders to get on board. So I don't know, Sandra, if you have any thoughts on that. I know you sit on the health side, but I'm wondering just if you see issues like school safety or response to the opioid epidemic, or, if there are any issues that are rising to the top that you feel like are ripe for that cross-sector collaboration to address.
Yeah, actually, I see multiple opportunities. School safety is definitely one of them. And as I said, we got a lot of requests for support around that early last year after what happened in Parkland, unfortunately. And we've really moved the conversation towards what is the health and education and behavioral health nexus, including a lot of state interest in what Alex just described around, how can we bring Medicaid into schools more and really create more of a tighter link between school, community, and support. So that's one. Definitely the opioids crisis, and a lot of kids who have had to enter the foster care system or disconnected from their families in one way or another. It really presents an opportunity for either schools as hubs or in partnership with educators and health and substance use providers to really think about the whole family. So that's definitely a way in. As I mentioned before, there's a lot of interest in governance structures on the state level to coordinate work for children across the age span. I should say from 0 all the way to 26. There's a lot of opportunity there, and some states are for the first time or rekindling their efforts to develop children's budgets. So that's an opportunity to bring agency leads together to understand what their investments are and the programs are and how to work together. Those are just a few examples. And again, I would say adverse childhood experiences. While it's something that we've known about for quite a while, there's an increased interest on the health proper side of the equation in those unfortunate issues and creating trauma-informed systems. And I think that's another way in for collaborative efforts.
Wonderful. Thank you so much, Sandra. I don't know, Hannah or Ann, do you have any thoughts on that question of where you might see opportunities for cross-sector support?
Alex, this is Ann. I would just say really ditto to what Sandra said, particularly around school safety and cross-agency partnership around supporting the whole child, and also around health, around responding to the opioid crisis as well. And we're actually engaged, CCSSO as an organization, with NGA on some cross-sector partnership work that I think reflects the fact that there are opportunities around, across between health and education.
Great. Thank you so much. Sorry, Hannah, did you want to add a thought too?
Oh, I was just going to add, I think as I mentioned, one of the most innovative things that states are doing is really thinking about how Medicaid can play a connecting role between healthcare services and other sectors. And I think there are some states that are doing this really well when it comes to Medicaid in schools, where they are using Medicaid as sort of the intro in a school setting to provide a whole range of services and making sure those services are coordinated across sectors, using Medicaid to identify where there are other social or community service needs, and then connecting those providers and managing care and services across the full spectrum of needs. And there are lots of different ways that states can do that. They don't need a waiver or any sort of federal permission to try to do that. But for the states that have sought Medicaid waivers to help support that work, I think that is really a promising area. So for folks who are interested, I'm happy to talk further about that offline.
Alex, can I offer one more thing? It's Sandra.
Please do.
One more thing that is really getting a lot of attention is early education and preschool readiness, which of course involves a whole bunch of different sectors, including childcare, et cetera. But there's a lot of interest on the health side with respect to maternal and child issues and how that dovetails with what we're trying to do around early education across the country, and also preparing kids for K through 12. I was going to say something else, but I forgot it. But early education is
Great, thank you. I think that is a really important one to lift up, and I appreciate you adding that. So the next question is specific to the President's FY 2020 budget. And so Hannah, you might be able to speak to this on the health side. I can actually try responding on the education side, but just, recognizing that the budget, the proposed budget included some significant cuts and changes to health and education, and just wanting to know if we can speak to what those changes were and really understand the extent to which that is a threat to some of these programs. So Hannah, I don't know,
Sure.
do you have thoughts on the health side, and then I can speak to the education side, and Anne, you can certainly add any thoughts from CCSSO too.
Sure, absolutely, yeah. So I think very big picture, the bad news is that the budget proposed massive hundreds of billions of dollar cuts to Medicaid and other healthcare programs. The good news is that Congress seems not at all interested in taking and enacting those cuts. So it is still certainly a threat, and I think it still is very concerning and dangerous that is the administration's proposal and their policy position. But I think, I would not lose sleep over the possibility that these cuts as proposed will be enacted by Congress. So very big picture, the budget calls on Congress to enact legislation modeled closely after the Affordable Care Act to repeal and replace bill that nearly passed in 2017, the bill that was drafted by Senators Cassidy and Graham. That would, and then beyond that, proposed even greater cuts in various areas. So just as a reminder, that bill would eliminate the Medicaid expansion, which has covered almost 13 million low-income adults, and would also eliminate its marketplace subsidies, which currently provide financial assistance to about 9 million people to help them afford coverage. It would replace the ACA's major coverage expansion with a completely inadequate block grant, and then would convert the rest of the Medicaid program, so the program that covers kids and seniors and people with disabilities and pregnant women, it would convert it to a per capita cap, which would limit the amount of federal funding available. So overall, it would cut we estimate $777 billion over 10 years, and then those cuts would grow over time. So that's just the first piece. It also proposes a lot of other restrictions and cuts. So it would implement a policy taking Medicaid coverage away from people who don't meet work requirements nationwide. So whereas the administration has been approving those policies at a state-by-state basis, this would require it for every state. It would substantially increase red tape for Medicaid beneficiaries, make it harder to access Medicaid. It would require documentation of immigration status before coverage takes effect. What else? It would allow states to reimpose asset tests. It would make marketplace coverage less affordable. Whole slew of really harmful and dangerous policies, some of which the administration is pursuing administratively. So unlike the really big, block grant per capita cap cuts, clearly work requirements and some of these other proposals the administration is pursuing. So I think that aspect of it is really important to stay alert and pay attention to.
Great. Thank you, Hannah, for that overview. And just quickly on the education side, again, I can't emphasize enough what Hannah said regarding, that we do not expect the majority of these changes to actually happen, but I think it is helpful insight into where some, the administration's priorities are. The budget proposed for FY 2020 included about $7 billion in cuts for the Department of Education, and the majority of those cuts came from, there was about over $2 billion in proposed cuts for teacher training programs, and then a little over $1 billion in cuts for after-school funding, and then also a little over $1 billion for a program called the Student Support and Academic Enrichment Grant Program, which is actually the only designated funding within the Every Student Succeeds Act for health and wellness. We also saw it's actually on the Department of Treasury side, but a proposed tax credit of $5 billion a year over 10 years, so $50 billion total, that would support school choice. So that has certainly been something we've continued to see running through this administration is, the interest in supporting school choice, and so we saw that reflected in the budget. There's also, I think, on the other side, there's a funding for school safety initiatives. So certainly a increased focus and continued focus around school safety initiatives. So potential funding opportunities for states and districts around that. And Anne, I don't know if you have any thoughts to add, or if that kind of gives the quick overview.
Yeah, I think that's a good quick overview.
Great. So I recognize we're at time. We're actually a minute over time. So wanted to wrap things up. And actually, the next slide has everybody's contact information again. I know a couple people have asked for that. We really appreciate everybody's time today, and thank you again to our presenters for sharing their expertise with this group. We will follow up with an email with the slides for today, in addition to some of those resources that we mentioned on the webinar. So thank you, everybody, and we hope you all enjoy your afternoon or evening. Bye.